Today, we are going to talk about acupuncture for chronic pain, and particularly, we are going to talk about neurobiological and neurochemical mechanism for its benefit. Because a lot of people, particularly modern medicine, do not believe that acupuncture is helpful. So we are going to discuss what is the mechanism of effect, the neurochemistry, neurobiology, and the mechanism of its effect, and gate control theory, how it affects, which areas are affected, and that is coupled with the scientific evidence. So let's just think. Acupuncture is a therapeutic modality of traditional Chinese medicine or TCM for thousands of years and has gained a global recognition for its efficacy in treating chronic pain conditions such as low back pain, osteoarthritis, fibromyalgia, migraine, and neuropathic pain. Acupuncture involves inserting fine needles, very, very thin fine needles. And I had acupuncture on myself when I had low back pain or sciatica. This is so thin that you just know a needle insertion, but not painful. So these fine needles are inserted as specific points in the body, and these are called acupoints. And the purpose is to restore the flow of chi or vital energy through the meridians. Meridians are the lines where there is expected energy flow, and blockage of the flow is expected to cause pain. And this purpose is realigning that flow. While rooted in the ancient philosophy, modern science has elucidated multiple neurophysiological and neurochemical pathways that underline the acupuncture's analgesic effect. So the first one, we are going to talk about gate control theory and peripheral neuromodulation. The gate control theory of pain posits that non-nociceptive input can inhibit the pain signals at the spinal cord level. Acupuncture needles stimulate A delta and C afferent fibers, which modulate dorsal horn neuron in the spinal cord, closing the gate to nociceptive signals from reaching the brain. Sorry for disturbance. So I was talking about the gate control theory and acupuncture stimulating the alpha delta and C afferent fibers, which modulate the dorsal horn neurons in the spinal cord, and that result into closing the gate to the nociceptive signals from reaching the brain, and therefore the pain signals are controlled. And this is very helpful in chronic pain, particularly if you found the inflammation is already controlled. The second main important part underlying this is activation of the mechanoreceptors and proprioceptors through needling, which can inhibit the nociceptive transmission via inhibitory interneurons in the substantia gelatinosa, particularly lamina 2 of the dorsal horn. And also, segmental inhibition decreases the excitability of the wide dynamic range WDR neurons, which are central in the pain amplification in the chronic pain conditions. The second thing we're going to talk about is activation of the endogenous opioid system. One of most well-documented mechanism is acupuncture's stimulation of the endogenous opioid system. Electroacupuncture, particularly called EA, at varying frequency induces the release of the distinct opioids. Particularly low-frequency electroacupuncture 2 Hz stimulate the release of beta endorphins and enkephalins. On the other hand, high-frequency electroacupuncture 100 hertz promote the release of the dynorphins. These opioids act on the mu fibers, delta fibers, and kappa opioid receptors in the central and peripheral nervous system to reduce the pain perception. It is worth noting that acupuncture-induced analgesia is reversible by naloxone, an opioid receptor antagonist, supporting the opioid-mediated mechanism in the acupuncture. So you can see the scientific basis and method of reversal, which proves the effect. The next, we are going to talk about modulation of serotonin, dopamine, and norepinephrine. Acupuncture is known to modulate monoaminergic neurotransmission, crucial in descending pain inhibition pathways. Serotonin or 5-hydroxytryptamine is important, and acupuncture increases 5-HT level in the periaqueductal gray matter or PAG. Also increases 5-HT level in nucleus raphe magnus and spinal dorsal horn, and thus enhancing the descending inhibition. In addition, it has effect on norepinephrine and stimulate the norepinephrine release in the locus coeruleus, which dampens the pain signals in the spinal cord via alpha-2 adrenergic receptors. The third point is effect on dopamine. Emerging evidence suggests dopaminergic modulation, particularly in the mesolimbic system, contribute to the acupuncture's mood lifting and pain reducing effect. Now we're going to talk about reduction of the central sensitization and neuroinflammation. Central sensitization is a hallmark of the chronic pain, and it involves heightened neuronal excitability and synaptic plasticity. Acupuncture mitigates this by downregulating the NMDA receptor expression and mitogen-activated protein downregulation. Particularly, mitogen-activated protein kinase pathways or MAPK pathways in the spinal cord, reducing long-term potentiation or LTP linked to the pain memory. And this is very important in the long-standing chronic pain where even the inflammation has gone, the long-term pain memory is existing. The other effect is also by inhibition of the microglial and astrocyte activation, which are sources of the pro-inflammatory cytokines interleukin-1 beta, TNF-alpha, and interleukin-6, which sustain the chronic pain. And you can see how these pro-inflammatory cytokine in the neurological pathways, including the microglial and astrocyte, cause persistence of the pain. The third effect is enhancing GABAergic and glycinergic transmission, restoring the inhibitory tone in the spinal circuit. Let's talk about the functional brain imaging and pain network rewiring. So the pain network rewiring is very special function that happens in acupuncture. And there is proof through functional MRI and PET studies, which is positive emission tomography. And PET studies and functional MRI show the acupuncture alters the activity in key brain areas involved in the pain matrix. And this includes decreased activity in the anterior cingulate cortex or ACC, as well as decreased activity in the insula and amygdala, and somatosensory cortex. And these are all implicated in the pain perception, emotion, and memory. Also, there is increased activation in the para-aqueductal gray matter or PAG and prefrontal cortex, which are regions responsible for top-down pain modulation. There is also change in the default mode network or DMN and salience network connectivity, which may explain long-term improvement in the pain coping and emotional regulation. Let's talk about the clinical evidence and meta-analysis. Numerous randomized controlled trials and systematic reviews support acupuncture's efficacy. Particularly, I give example in 2018, a big meta-analysis of over 20,000 patients showed acupuncture was superior to both sham acupuncture, which is like a placebo acupuncture, and no acupuncture in treating chronic musculoskeletal pain, osteoarthritis, and headache, with effects persisting over 12 months. The American College of Physicians recommends acupuncture as first-line therapy for chronic low back pain due to the favorable risk-benefit profile. I may just conclude that acupuncture is a neurobiological modulator of the chronic pain downregulation with clear beneficial effect. Acupuncture achieves chronic pain relief through multimodal neuromodulatory strategy, including peripheral spinal inhibition of the nociceptive signals, activation of endogenous opioids and monoamines, reversal of central sensitization and glial inflammation, functional reorganization of the pain-related brain networks. These mechanisms validate acupuncture as biologically credible evidence-based intervention for chronic pain. Its integration into pain management program along with modern medicine can offer non-pharmacological, cost-effective, and patient-centered care, reducing dependency on opioids and other medications, as well as improving the quality of life in patients suffering from chronic pain. Thank you.